In this edition of Ask the Doc, I got a question from someone that has been dealing with some significant neck pain for over a year and tried care with multiple providers, all with little or no relief. They're finding themselves frustrated and tired of spending money on forms of treatment that never seem to have long lasting results. In this video, I cover the following. What exactly does it mean to get treatment for an injury? How to tell if the provider you are seeing has any clue as to what is going on, how long you should wait to see results, and lastly, what is the best treatment option to get long lasting results. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and then reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long lasting pain relief. Back at it for Ask the Doc. Just a quick reminder, you can send any questions directly to me on neck, shoulder, elbow, and wrist injuries. And if my insights can help, I will make a video. This week's question was, let me pull it up. It said, I have been dealing with some pretty severe neck pain for the past year or so. I have seen well over 10 different providers, ranging from massage, chiropractic, physical therapy, acupuncture, and even two orthopedic doctors. Each time, they all seem to know exactly what is wrong with me and can help, only to find myself 10 to 20 visits in with no results and less money in my pocket. I am more than frustrated. And if I have to hear another doctor tell me that there must be something psychologically wrong with me, I'm going to lose it. How do I know the treatments will work and quit wasting my time and money on lousy doctors who don't seem to have a clue and only blame me or call me crazy? Thanks for the question. And I'm really sorry to hear you're dealing with this nonsense. Unfortunately, I get a lot of these questions pretty much every week because the current medical model is broken in so many ways. So let's just start with defining what a criteria is for a good treatment. And this comes from those wonderful folks over at the FDA, the Food and Drug Administration. First thing is it must be safe. Basically, is it safe? Is it causing any harm? Next is effective. And last is durable, or better known as long lasting. So, in order for them to approve a treatment or a medication, it has to be safe, it has to do something, and it actually has to be long lasting. So, how to tell if the provider you're currently seeing has any clue as to what is going on? Number one is, did they spend more than 5 minutes with you and ask you some questions about what's going on, taking a very detailed history about what's going on with your problem? Or did they just jump right in and get started? Next one is, did they ever do like a full exam or an evaluation, or did they even get out of the chair or out from the other side of the desk and actually do something? Did they perform any tests or measurements or anything like that? And lastly, did you have to wait forever to see them and stare at a waiting room full of other frustrated people? Yeah, that's a clear sign that they're way overbooked and they're going to have zero focus at all at getting your problem fixed. How long should you wait to actually see some results? This is what I call the 5 visit rule. 5 visits is the maximum time you should wait for seeing some type of result. So, what are those results? Here's the thing, they're not always just an improvement in symptoms, like you feel better, but it should be some form of a functional improvement that came from a baseline test. We started with this, it's limited, it's continuing to get better. What I'm looking for in those first 5 treatments is an improvement in function, showing me that treatment's working. So you want to give it at least 5, but no more than 5, because that's going to tell you in that time if what you're doing is actually helping. So in order for any of your symptoms to improve, to feel better, you must improve functionally. I always tell my clients and everyone that I train, in order to feel better, you must function better. In order for symptoms improve, you must function better as well. And treatments that really only get rid of your symptoms temporarily, yeah, they might be effective in that, but they're not durable, they're not long lasting, and you need to have the function improved as well, because if they're only improving symptoms but not function, it's dangerous. It's kind of like The symptoms are the check engine light of the car. They're telling you there's a problem. And a lot of those so-called treatments, they go in and they remove the symptom. It's like unhooking the check engine light, but it didn't fix anything. And then that problem gets a lot worse down the road and a bigger problem for you to handle. So, what is the best treatment? Well, first off, yeah, it definitely should be safe. No brainer. It should be safe to start. Next is it should be effective. It's important that it's effective, especially I say in improving range of motion and function, because as those things get better, things are going to start feeling better as well. But the most important component of the treatment is it durable? Basically, is it long lasting? Can it hold for more than a day? Hopefully, can it hold for a week? Can it hold for longer? That's how you decide if a treatment is actually a good treatment. So, how do I look at this in my own clinics and how we approach treating clients? First off, is we start with a 30 to 45-minute detailed functional evaluation. We do lots of tests, collect lots of data. We do videos, we do functional tests, we do pictures. We really know what we're working up against. So we have a lot of baseline data to know if we're making progress. We also help the client understand exactly what they can do and can't do in between treatments so they don't mess it up, they don't screw things up, they get it in a good place. Next thing is we don't overbook. We only take on what we can handle. So the client gets my full attention or any of the other peak method providers' full attention without all the other distractions. And we're on time. We respect your time. So we'll get you in and out. And lastly, we're constantly communicating with the client throughout the process about what we're doing. We're showing them how the treatment is working. And we're really being a source where they can ask questions or voice any concerns. Now, I know this isn't the norm in the current medical model, but I wish it would be. And a lot more people would have better outcomes and really never have to resort to the horrible path of pain pills, injections, and surgeries, which only make things worse. So if you find yourself being strung along by some doctor or a provider and you've been going for way too many treatments with no results, but they keep telling you you just need to be patient and come back, it's time to find a new provider. And when you're trying to decide if they can help you, remember the keys I shared to know if they have any clue as to what they're doing. If you're tired, you're frustrated, you're in pain, you haven't got answers, you can reach out directly to us and we'll get you set up with a peak method trained provider that meets all of that criteria and gets you on the path to feeling, functioning a heck of a lot better and getting long lasting pain relief. I appreciate you guys watching this and I'll see you on the next one. Bye.